Hi, my name's Chris. Today I'm going to be talking about the INTERLACE trial. The INTERLACE trial is looking at induction chemotherapy followed by chemoradiation in patients with locally advanced cervical cancer. The main findings from the paper were that there was an improvement in 5-year OS as well as PFS, and this did not discriminate whether they were node positive or node negative or whether they had certain histology. This was a phase 3 randomized international study conducted in Brazil, Italy, India, Mexico, and UK. They were looking at histologies of squamous, adenocarcinoma, and adenosquamous. Their inclusion criteria were as followed. They were able to do 1B1 per 2008 FIGO staging with nodes, as well as 1B2, 2A, 2B, 3B, and 4A. They did not include 3A patients, nor did they include patients who had positive lymph nodes above the aortic bifurcation. From 2008 FIGO, the 1B1 with nodes only made up 1% of the entire population, while the 1B2 made up 8.4%, the 3B was 11%, and the 4A was 2.6%. The design of the study was a 1-to-1 breakdown, 250 people into each arm with stratification based off of site of enrollment, FIGO stage, lymph node status, age, and histology. For the experimental arm, they were given weekly carboplatin AUC of 2 as well as Taxol 80, and then they were required within 7 days to be started on EBRT plus cis at 40, and the control was just getting that chemo RT, which is the EBRT and cis at 40. So looking at the stratification for protocol adherence, those with induction chemotherapy, 84% completed 6 cycles and 92 completed 5 cycles of the induction chemo. And then regarding their ability to start within 7 days after finishing their induction chemo, 89% started within 7 days or fewer, and then 17% started between 8 and 14 days after their last induction chemo. So for the main findings, there was the median follow-up of 64 months for all of these patients. For PFS at 5 years, there was a 35% relative risk reduction in patients who were receiving induction chemo, and at 5 years, there was a 10.8% absolute risk reduction for those that were receiving IC versus just chemo RT. Going to their other primary endpoint, which was overall survival. At the 5-year mark, overall survival was 80% in those receiving induction chemo, while those in the control were at 72%. And likewise for distant relapse, 7% were noted in induction chemo and 12% were noted in the control arm. Next, rolling over to toxicities, comparing induction chemo to control, grade 3 or grade 4 adverse events were 59% and 48% respectively. Out of those 59% in the induction chemo, the most common cause was neutropenia, and 22% of that was during the induction chemo phase. So a couple other takeaways from this study were that, one, this was dose-dense weekly induction chemo, not done Q3 week, which the Q3 week trials ended up showing no benefit. So weekly induction chemo did show a benefit, and the postulated theories for this was that you're going to be giving a dose-dense form of it. And then secondly, the theory of eliminating or reducing that repopulation event for cancer. Given the fact that chemo RT is known as definitive treatment for these patients, it's important to make sure that when they were receiving induction chemo, they were quickly able to go to EBRT and there wasn't a delay in that event. And we were able to show in the study that 89% got it within 7 days and 14% were 8 to 15 days. When you looked at those that started EBRT at 7 days after induction chemo versus 14 days of induction chemo though, there was actually no difference in relapse rate or death. The other important thing is that in radiation, it's important for us to make sure that they get their dose within 56 days. So in this trial, the median time to receive their chemo RT was 45 days, with 97% in the chemo RT and 96% in the induction chemo plus chemo RT receiving it within that 56-day window. And the last thing for this paper was that it did not include immune checkpoint inhibitors. So we know that the addition of pembro in patients for A18 did show benefit. The question now is, what is the landscape going to be for patients regarding potentially getting induction chemotherapy as well as potentially immune checkpoint inhibitor? And that's the breakdown of the INTERLACE trial. The more you know.